There are 12 districts in Meghalaya. There is a district health associate who's going to be placed at each district, who will be the learning layer for the government. As the learning layer, they are able to look on the ground and see what policies are working, which are not working and why they are not working, and what are the different priorities for universal health access and things like that on the ground. Give that as a feedback mechanism back to the government, and this happens through the team that UNICEF sets up at the state level.
Assistants are going to help the district implementation teams, as we call them, district human development teams, who would actually use their services to facilitate the discussions based on this human-centric design.
So we're having a 3-day workshop with UNICEF, IIT Bombay and all of the district health associates to build their capacity over these initial 3 days. And this is something that will continue on a quarterly basis. So every quarter their capacities will be built so that they can go to the field and perform better. What we are hoping that this will do is it will create an ecosystem in the state for public health and for public problem solving, which will allow the state to listen to what's happening on the ground and then come up with solutions. Of course, it will involve introducing innovative devices. It will involve creation of dashboards and apps and things like that. But it's going to, the starting point of this is sort of now shifted closer to the communities, giving everybody a better chance at solving the problem.
Meghalaya being a state with a lot of geographical as well as community challenges, it becomes even more imperative to build that capacity at the local level.
The state is trying to improve the overall health outcomes. A lot of indigenous population living in a lot of remote areas. So you need to really design our program implementation in such a way that actually we are really understanding people's issues, and accordingly we are able to mobilize them for better outcomes. Today's workshop is very important because UNICEF and the state government and also blockchain for impact. So all together we are coming together, and I really appreciate the work that's happening here. One thing what we understood is that there is a lot of need for mobilizing people, and mobilizing different stakeholders.
This partnership with the Government of Meghalaya and BFI are very, very important starting point. This is a kickoff of or the first step in a long journey. We look forward to working together with BFI, state government as a partner.
It's a very, very important intervention for the state, particularly at the public health point of view, where smaller states like Meghalaya requires a lot of capacity building at the from the fundamental levels to ensure that the health and nutrition outcomes are to the desired levels.
So with the human-centric design, the idea is that that's what actually we also use in the states, called state capability building approach. The idea is that you need to address the systemic issues so that you get a more sustainable outcomes.
So you have people on the ground who are closer to the problem. You have the team at the state level who understands, who has access to the policy, they understand data, and using the both of this, they're actually able to bring in partners, pilot solutions.
And I'm very thankful for BFI who have been in supporting us for various initiatives in the state, and particularly with this, because this goes fundamentally in system strengthening. And the system strengthening, as we know, once done, is going to have a long-term impacts.